Okay, so I just have to do this video really quick. Tara Boston Kemper from the Counseling Hub. So, one of my favorite areas in counseling is couples work, and I'm not saying that I am by any means one of the greatest couples therapists ever, not at all. But I will say that what I find really, really helpful and that helps couples get through things like, I don't know, being on the brink of divorce and going to couples counseling and it being successful. Here's my point. If you are going to find a couples therapist, try to find someone who's especially trained in something like Gottman couples therapy. This is a type of marital therapy, a type of couples counseling, relationship counseling, whatever, that's been around. Well, it hasn't been around for 40 years, but Gottman's been doing he's done 40 years of research on couples. And I don't mean research like he's asked them questions and they've just told them what they think. I mean, he's hooked people up to, they're called like oximeters, where they monitor your heart rate so you know when you're being physiologically aroused by something. They've done like cheek swabs, like testing cortisol levels, stress levels. Cortisol is a chemical, hormone, one of the two, and it's stress hormone basically. They've recorded couples with their consent in what they call love labs. So they set up this apartment. They have couples come in and kind of exist on a daily basis, and they just like record them from all the different rooms, I think except the bathroom. And he's come to find some pretty solid scientific findings. So that basically love and relationships, that there's magic to them. Oh, not magic, I'm so sorry. It's magical. There's math. You can figure out how to make them work and how to make sure that your relationship lasts and that you're going to be with this person forever, and how to keep, dare I say, keep romance alive. I don't want to say that because I don't want you to think that it's the falling in love feeling forever, because that's not the case. That's not, maybe a handful of people have that. Realistically, the vast majority of the people in the world are not going to sustain that feeling for the duration of their relationship. That's just the way that it works, and that's okay. That's normal. Okay, my point is this. It really grinds my gears. I'm just kidding. No, for real though. It pisses me off whenever I read stuff that people talk about the things you need to make a relationship work. Or when I do couples therapy, I make sure that if I was this person, if I was a person who was, from my perspective, in the wrong, and I was another counselor, so we'll just say my name is Jill. I don't really know a Jill. That's a counselor that does things wrong. Anyway, so let's say I'm Jill, and I'm like, hey, all you need to do is not fight and make sure you listen, and that's it. Like, that's how you make sure you're in a good place. That's not it, Jill. I'm Tara. That's not it, Jill. That's not it. There's so much more to it. So I'm irritated about this because I just read something where it was a counselor who had, like, there were books out, and she's talking about these notions that are just not supported by research and frankly not true. Like, they've been discredited. They've been proven wrong. And that gets me every time. As counselors, as clinicians, you may or may not know this, we are required to do ongoing training. We're supposed to be intelligent, smart consumers of research, which means that anytime there's stuff that comes out, and I don't mean one study is the be-all, end-all. I'm talking, Gottman has like a bunch of studies, and it's over years and thousands of couples. So I think thousands. Anyway, my point is that we are supposed to be good consumers of research, where we take in information and we make decisions based on things that have evidence, that there's evidence for them, that we know that they're effective. And as much as I would love for my personal anecdotal experience with people to be considered evidence, it's not. That's not fair. Plus, we don't know long term. So if I have someone come in for couples therapy and they're done after 6 months, which is totally reasonable, and then I don't see them in 10 years and I think I'm so effective at what I do. But the reality is that after 6 more months, all the stuff that we didn't stick because it wasn't based on any evidence, and the problems that were there from the get-go were still there, and the feelings, there was more resentfulness and more, more resentfulness, more criticism, more of the four horsemen that Gottman talks about. And then that led to marital dissolution, that led to divorce, and they were just kind of like, F it, I'm done. I don't know what is actually effective if I just base it on my experience, because how do I know that the people who are seeing me are going to come back and see me if they're having problems? Or how do I know if they're actually happy? Or how do I don't know. That's what I'm saying. And I can't make blanket statements about all couples and how this is just exactly what you need. You just need to learn, you just need to avoid these emotional triggers and do this instead. I hope this makes sense. I just get really frustrated with that kind of stuff because I love couples work, and I have seen some amazing, I mean like amazing turnarounds from people. It's really, I don't know. It's the Gottman method in particular. It's so simple. It's not, of course, not easy. What is simple and easy, right? But it's just so simple and so beautiful, and it takes work, and it works. It's highly, highly effective, which is my favorite thing about it, that I can really trust this thing. And I've read a lot of his research, whatever. So those are my thoughts for the day. So if you are seeing a marriage counselor, ask specifically, what training do you have in couples therapy? Ask specifically, okay, what's your couples theoretical orientation? How do you know that the stuff that you're doing is effective? And if they can't really answer that question, then find a new counselor who can. That's all.